Getting your child into treatment is a significant milestone in the recovery journey. Depending on their age and the requirements of the state where your child will be in treatment, your child may need to provide consent to allow the facility to share information about their treatment with you. This consent is documented on a form called a Release of Information, or ROI. It protects your child's privacy. In this video, we'll take a closer look at how the ROI works and how to have a constructive conversation about this document with your child. During the admissions process, your child, again depending on age and state regulations, will be invited to sign the ROI form. In fact, most treatment centers require an ROI for the financial guarantor and relevant family members. The ROI form can be limited, meaning it deals with specific areas of information such as financial information or attendance. Or it can be a broad one that covers all information relevant to your child's stay in treatment. For the purposes of this video, we're going to focus on ROIs that permit sharing of information about treatment and attendance. With your child's consent, the facility will be able to answer questions about your child's care and keep you posted on their progress. But it's important to know that without an ROI in place, the facility won't be able to tell you if your child is in treatment. If you call and ask for your child without being listed on the ROI, you may get a response such as, "We can neither confirm nor deny that they are in treatment at this time." That may seem extreme, but health information is protected by law, and facilities must comply. Intake teams are trained to navigate the delicate issue of the ROI, but it's also a good idea to discuss it with your child before they get to the residential program. Together, you can set expectations. Explain to your child why it's important that you're informed about their progress. Be clear and honest with them. Let them know it will help you align with their treatment providers to more effectively support their recovery. Attempt to address any concerns they might have. It's not uncommon for a child in recovery to be resistant to the idea of sharing treatment information. It's also not uncommon for the child to be willing to share with one parent, but not the other. If you face this situation, it's normal to feel hurt. But remember that the goal is to get consent so that you can stay informed to support their recovery. Start where the willingness is, then go from there. If one parent has a better chance, they should take the lead. This can sometimes be enough to cause a shift in your child's attitude. As they go through recovery, they may see it's beneficial to collaborate with all the members of the parenting team. Once you have consent, respect it. Honoring your child's privacy and trusting the rehabilitation professionals is part of rebuilding relationships. Depending on a state's age requirements, a young adult can revoke the ROI and shut you out of the process. To rebuild connections and keep the lines of communication open during this process, do not misuse the ROI for other purposes. For example, well-intentioned parents may try to control treatment by asking a therapist what their child has shared about past trauma, or they might ask to be kept informed on specifics of clinical sessions. These are not constructive ways to support treatment. The main reason residential treatment programs have a release is to encourage support and collaboration between the team, the individual in treatment, and their loved ones. Treatment teams value the family perspective. You offer much needed information that your child may not provide. Allow yourself to trust the team, focus on providing the information and support that only you can. In time, maybe even from the first mention of the ROI, your child is likely to see the benefit of having family collaborate with the treatment team to support their recovery.